Intelligence company that specialises in skin cancer services has raised £4 million to expand partnerships with the National Health Service. Skin Analytics launched the first AI-powered clinical pathway for skin cancer in June, which reduces delays in detection and treatment. Well, joining me live from central London is the Skin Analytics Chief Executive, Neil Daly. Neil, welcome to you. How does this work? This is you've come up with a way of analysing tumours, I guess, have you?
Yes, thanks for having me. Yes, effectively, what we're facing in the UK is a real capacity constraint with over 1 million dermatologist appointments each year in the UK for skin cancer. And what we are able to do with our artificial intelligence is really work with either primary care doctors or with the dermatologists themselves and reduce the number of those patients that need to be in there face-to-face with the dermatologist by between 40 and 60% by using this artificial intelligence.
What's been the reaction of doctors and dermatologists themselves? I mean, we often hear about jobs being displaced by AI and by robotics, but they're normally fairly low skilled. You're talking about a machine doing the work of a skilled doctor here.
Well, firstly, we only have 650 full-time equivalent dermatologists across the UK dealing with that huge volume of patients. So there's more work than can be done by the dermatologists we have. And so it's more about a crisis within the dermatology community of being able to train and staff up the empty positions around the UK. So the artificial intelligence here is really augmenting the capacity that we have and is allowing us to build these new pathways that can really complement clinicians rather than replace them.
And presumably because it allows clinicians to spend more time on treatment than diagnosis. I mean, how much of a saving could that be for the health service?
Well, we've been doing some work with Imperial College at the moment to look at exactly how much saving we can drive for the healthcare service. But what we do know right now is that we can reduce by between 40 and 60% the number of dermatology appointments. And that can dramatically reduce the cost of appointments to the NHS, but also the cost that they spend trying to clear the backlog of cases that we have right now across the country.
Now, your technology is being used by both the NHS and by the private sector. Are you making money out of it at present?
Well, we've spent a number of years focusing on building the clinical evidence, having our device registered as a medical device and regulated appropriately. So we've only just begun the commercialization this year, but so far we have 5 commercial partners and we have a really strong pipeline of new hospitals and CCGs that we're working with across the country. So we expect to be able to really drive the adoption of this technology over the next 6 months.
And what about the export market? Are there certain locations that you're looking at as well?
Well, we're delighted to have been accepted or been given breakthrough device designation by the US FDA. So that's a fast-track program to go through the regulatory process in the US, and we hope to have something live there as soon as we possibly can.
And you've just raised $4 million in this funding round led by Hoxton Ventures. What will the money be spent on?
So we have those 2 streams. The first thing we need to do is to add to the team and really build out some of the skills to get our product into the hands of more people faster. But we also have to invest in continued clinical evidence and the regulatory process for the US. So those are the areas that we'll focus on for the next 12 months.
All right, Neil, very good to talk to you. It's a fascinating story. Thanks for sharing it with me.
Thank you very much.
And that's it from me. There's